So high-dose vitamin C technically is considered any daily dose above 10,000 milligrams or 10 grams. Now most people, or many people today, take supplemental vitamin C by mouth, and the most common dosage is a 1,000 milligram tablet. Sometimes it's 500 milligrams. But the big thing to understand is that above 10,000 milligrams per day, which is 10 of those 1,000 milligram tablets, it can trigger diarrhea in a person. And so it's hard to get much higher of a dose. Well, in treatment of some diseases, we treat with 50,000, 75,000, sometimes 100,000 milligrams or 100 grams. And so the only possible route to avoid the diarrhea complication is through intravenous vitamin C. And the big thing to understand about vitamin C is technically it's listed as an antioxidant, which it is. However, Linus Pauling, a Nobel laureate biochemist, proved that one of the ways that vitamin C helps to fight infectious disease and cancer is by creating what's called an oxidative effect. And the reason is it specifically stimulates a certain type of white blood cell in the immune system. And this white blood cell, one of the ways that it has for killing abnormal cells or infectious organisms is that it manufactures hydrogen peroxide internally, which is deadly to all these things. And by boosting the amount of vitamin C, you enhance the production of that internal hydrogen peroxide, very safely, I might add, because there has never been found a toxic dose of vitamin C. The other thing to understand about vitamin C is that we do not use it in and of itself as a standalone therapy. We use it in the context of an overall protocol combined with other integrative therapies, because that is the way we've seen it work the most effectively to fight infections and to strengthen the body's immune system in such ways that it can even fight cancer.